asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos. Well, again, welcome. Aren't Lou and Michael, aren't they heroes? Well, I hopped on the asbestos train, which should have already been in the roundhouse and put away 45 years ago. But it's still running, and it's still moving, and it's still claiming lives around the world. This is what I saw in a modern asbestos plant in 1971 when I first came to the U.S. Public Health Service. How sanitary and clean the operation was. The workers were standing there pulling the asbestos out of the bags with no masks. Out of this plant at that time, 50% of the workers in that plant had asbestosis. We have been following this population, and the incredible number of diseases among themselves and their family members is startling. It should have never happened. This is a school we went to in Wyoming in 1970s. All of the walls here, if I can find my point, well, I'm not very good at this. All the walls here, this is asbestos. See this sampling pump? That's what we put on workers. This little boy had higher exposure than what was allowed in the workplace by multiple times. And this is not an isolated incident. Well, when I first started, my mentor was a guy by the name of Dr. Joseph Wagner. And Joe really taught me a lot about epidemiology and about caring about workers and caring about what we do to protect workers. And I always like this quote, which says, if you can stop a man's exposure to a carcinogen, we stop the cancer. And that's something society can do. Well, in 1976, the organization I worked for made the first recommendation in the United States to ban asbestos in the workplace. As Linda has said, that still has not occurred. We still use asbestos in the workplace. And I'm taking you by decades. This is a situation in the Philippines. This is a refugee camp that held about 50,000 refugees from Cambodia and Vietnam in the 1980s. These are the buildings they lived in. That's asbestos roof, that's asbestos siding. You see there were numerous children, and this material, this is all asbestos that they've written on here on the walls. And not only they, but the workers were exposed that built these camps. Well, we still have asbestos going. This is a picture we took in 1990s in Russia of their production, and Russia keeps going and going and going while other countries have banned asbestos. Thankfully, Canada did a year ago. This is myself and one of our strong advocates, Dr. Michael Harbert, testifying before Congress a few years ago in the 90s about why we should ban asbestos. If you don't recognize it, that's me. That's Dr. Harbert. And so a new voice came on the block in 2005, and Linda's already shown you this picture. And many of the people in this picture are here today. And this was the beginning of the ADAO. ADAO has been active on the Hill, educating our Congress about the dangers of asbestos and why asbestos should be banned. This is work that Senator Patty Murray has been a strong advocate on our behalf of helping us in the Congress. Unfortunately, it hasn't been able to get very far, and Linda told you reasons for that. This is a picture I took And this is just symptomatic of what's going on. It doesn't show up very good with all of this light, but this is a pile of crucidolite asbestos in South Africa. And don't criticize me for the mask I wore, but that's the only thing I could find at the time I was there, but it's not adequate. Again, pictures of us and the asbestos disease awareness moving forward, advancing the knowledge of our Congress about the dangers of asbestos-related disease. Mark Indri is here from Paris. Linda and I and my son, I tried to get him a little bit active in this. We marched with around 5,000 people on October 13th in Paris, France, through the streets of Paris, France, talking about let's end the human rights violations, let's ban asbestos. Mark may talk a little bit more about this in his presentation. This year, Linda and I have been, and Aubrey Miller on our Science Advisory Board, went to Helsinki to participate in an update of their attribution criteria. I then went on to Berlin, where we put together a declaration on asbestos in Germany. And Linda went to Toronto to speak on behalf of asbestos-related disease prevention at a major conference there. Well, to end, I'd like to say that our asbestos disease is declining. As we see, in the developing economies of the world, they're starting to level off. They're not declining yet, but they're leveling off. But what's happening in the emerging economies? And you'll hear more about this from Professor Takahashi and others that will be speaking after me. So we still have a lot of work to do. And that work is time-consuming, but we need to do it, and we need to continue educating. Asbestos is still used in Asia, and if we don't stop it, we're going to continue to see pictures like this and hear stories like Michael's and Lou's. So, as an afterword, I'd like to say if society had followed just the basic principles of public health, specifically those that were recommended by 1930, that we would not have the pandemic of asbestos-related diseases that we're seeing in the world today. Our societal forebears have failed us. And that is why we're here today, and that is why those of you that are suffering asbestos-related diseases are experiencing what you're experiencing. And if I could leave but one message, I would say, let us not be responsible for such a legacy for our descendants. Thank you.